There are, in our healthcare facilities, silent heroes who save lives while changing the future. These silent heroes are nurses. Nursing is often an underappreciated art that has strong and lasting effects on our lives, which we can use in many facets, not just in our health. The nursing field has had a severe impact on the growth of society through military, scientific, and educational outlets. Now let me reveal 3 parts of our lives that nursing has had a hidden but important role in. Many of the events that caused the skill of nursing to come to light occurred during the dangerous and dark times of war throughout the world. The American Red Cross was one of the largest organizations to spread healthcare during World War I and to shed some light on the important effect that nursing has had on the military. Not only did the Red Cross supply nurses for the home front, but it also employed many young students who were trained as nurse aides to help fill in the gaps in America that were left after all the nursing staff went to Europe to assist in the war. According to the American Red Cross website, there were 23,822 employed nurses who assisted at least 500,000 families overseas through the home care program. Not only did nurses help assist in the caring for the physical ailments of soldiers during wartime, but they also looked after their mental health. Walt Whitman, for instance, was actually a nurse during the Civil War, and he had his greatest impact by just sitting and talking to the soldiers he was assisting. Hospice is a healthcare program set up with the purpose of just making the patients as comfortable as possible before they pass. And the largest aspect of this is just listening to the patients as they approach their final days and often want to look back on their life. The military is an important aspect of our lives, but science is another large area that nursing has a strong basis in. The actions and procedures completed by nurses throughout history have led to great scientific discoveries. Florence Nightingale was a wartime nurse who set standards for the future healthcare workers that are still followed today. While having a clean premises and proper personal hygiene may seem like an obvious way to assist in bringing down the levels of germs in a hospital, Nightingale was actually the nurse that pioneered the hygiene movement during the Crimean War. Nightingale's tactics were so effective that she opened up a school to train more nurses as a means to further the spread of her sanitary healthcare, thus changing the face of healthcare. Not only were nurses able to find direct changes that could assist in patient health, but they were also able to find indirect aspects of this care that could greatly improve patient recovery. Virginia Henderson, for instance, created a list of 13 goals or needs that needed to be met by patients to be able to be considered independent. And by giving patients the ability to be independent, it was possible to lower the amount of people admitted to long-term care facilities and the amount of patients in need of assisted care. Scientific research is a major aspect of life, but we couldn't get anywhere if it wasn't for the basis of education, and nurses happen to be a strong cornerstone in this movement. Nurses have had a major impact on the educational aspect of the healthcare field as a whole. One of the greatest areas of health education is the idea of public health awareness, in which a community is taught about proper healthcare practices to prevent illness. In the 1800s, Lillian Ward pioneered the idea of public health by reaching out to the community with community homes and by putting nurses into schools. Wald's ideas and programs are still in place and have created an overall awareness for proper hygiene by starting at the youngest age and continuing into adulthood. Sexual education is a very important aspect of healthcare today and has been involved in many social changes that have occurred in the last 100 years. In the early and mid-1900s, Margaret Sanger led the pack in sexual education at a time when it was illegal. She opened clinics specifically to teach women about contraception and proper sexual safety. Nursing is an aspect of healthcare that has had a great effect on many aspects of the growth of today's society. Nursing has had a great impact on the growth and moral of the military. They also affected changes in the scientific aspect of healthcare by discovering new procedures and important aspects of patient care. In addition, the field of nursing has greatly increased public health awareness and sexual knowledge. In the future, I am sure that nurses will continue to have a hidden but important effect on all aspects of our lives. Here's my note card.